Welcome to the Dana Grant Show, where heart-centered stories, authentic connections, real talk, and real action come together. I'm your host, Dana Grant. I'm a life coach, speaker, and believer in the boundless power within every one of us. Each week, we're diving into raw, transformative conversations that not only spark healing, but growth and unshakable clarity. Because you know what? Your story matters. Your voice deserves to be heard, and your purpose is waiting to be fully lived. You're in the right place. Let's begin. Welcome back to the Dana Grant Show, where I have a spectacular guest in the house today, Dr. Tommy Rhee. Not only is he a leader in stem cell, I'm going to look down at my notes here because he has so much on his resume. A sports chiropractor, he's a regenerative wellness practitioner, a best-selling author of the Future of Regenerative Medicine. He also was the Tampa Bay Buccaneers team chiropractor. That alone. Hey, welcome to the show. I'm so glad you're here.
Hey, Dana, thank you very much. We got a lot to talk about today.
Oh gosh, we do. And I mean, if we could have taped already, it's like we had to stop talking just so we could start taping because there's just so much expansive energy that you have to share. Hey, let's dive right in because I know we're going to tell the viewers here we've already had like a 45-minute conversation. Well, probably not 45 minutes, but close to it on a deep dive. So I want to recap all of that. And my first question, we're going to dive right in, is because I know you've taken a break from patients. And so I want to get all the little nuggets because I have so many questions for you. And do you like to go by Tommy or Dr. Rhee?
Whatever makes you feel comfortable. I'm fine with
Like
anyways.
Tommy, I love that. See, I had a stepbrother who was Tom. He's Tom now, but he's still Tommy to me. So I love that name, Tommy. So Tommy,
Yeah.
um, let me start there. What is live stem cell injections and what's going on in the stem cell world? I know you are so knowledgeable and you've dealt with athletes every day. You are on the front line. You wrote a book about it. Speak to me.
Well, here's the thing about that world, of stem cell, and you see these clinics advertise about live stem cells and the
Yes.
amount, like I got 10 million live cells. And here's the thing with
Yeah.
that whole world of like live cells. It basically means that the cell has a nucleus, it's like its own living source that can have the ability to do things, and that doing is like duplicating itself. So, in the world of stem cell, people think that these cells turn into your existing tissue that's damaged or worn out. If you look at biology and you understand about the chromosome and how it divides, there's no way that chromosome and your chromosome is going to match up. It can't. There's too much codes in there. So then you have to take the
Mm.
next step. So is it live cells or is it the other thing which is important is the message. It's the signals. And that's what's really important. And that's why you're hearing big buzzwords like exosomes, peptides, proteins, all these
Oh,
things.
let's slow down around that. The peptide thing out there in social media land and people talking about peptides. What is going on with that? Let's just like we're no side, but let's just quickly. What in the world is a peptide? Why is it so important? Why is it the buzzword and everyone talking about it? Stem cells huge, but peptides seem to be on the rise in 2025, 2026. Even my chapstick is peptides. And I'm like, ooh, peptides in it. I have no idea why. I just did it because it's so
It's
important.
just, yeah, it's just a bunch of amino acids. It's all it is. It's just
Or
signals.
amino acids.
Yeah, it's just a signal. It's a amino acid chains that are linked together, and because of the buzz of peptides and especially products like BPC 157, right? You hear that all the
Right.
time, right?
Yes.
So they discovered that the intestines have this kind of like ability to regenerate itself. And because when we go through our GI and we started like utilizing this type of process of absorbing and taking things out of
Mhm.
our food, well, the tissues go through a lot of work, so they have to recycle, fast. So because of that ability, there's a little information down there, which is that peptides that has the ability to recycle that type of layer in their intestines. Well, what these guys have done is they've taken that and they made a synthetic version of that, and then they inject your body with this, and it's supposed to give you that ability to regenerate anything, including whatever it is, like your tissues, your ligament, your tendon muscles, and all that. But the neat thing about that, it's again, it's not live cells, it's cell free. meaning that it has no nucleus. So now you're just giving it information. That's the signal. So when you hear peptides or even like exosomes, these are things that are just non like a nucleus and just cell free and it's just signals and information. So
Does
that's
it
what you're
work?
well, there's a lot of good studies on it. So, sure. I mean, if you get the right signal at the right time, absolutely it works. Because our body runs on signals. We always,
Mm,
we're always sitting waiting for some kind of information. Like we have hormones in our bodies. So let's say our
yeah.
brain secretes something and then it goes to a target tissue like your liver and it says, all right, do this. You eat a certain food, you have like a high amount of that sugar, glucose. Well, you have to
Mm,
have insulin. Again, a signal needs to go out there and grab insulin, right? So that's what our body's all about, is just sitting there waiting for information. And due to our aging, our signals decrease. When it decreases, now our
oh.
signals have a problem, and now we can't have that ability to do its normal function. So if we can induce her to a better signal, well, here we go. Now we're back to normal. So that's what's fun about this time now. It's not so much, getting invasive with like surgery and blocking and kind of like doing
Mhm.
aggressive therapy. It's just getting the right signal to your body that says, do your proper job.
Mm. So you said that, and I'm going not off course again, but you just generated a new question. Is there an age barrier that, like, in my 60s, and someone just said there is no bone on bone, but I had knee surgery where they removed the cartilage because I had torn it. And they said, hey, you need a knee replacement. I chose not to, and I'm doing great. Like I told you before, I walk the Camino, I'm doing great. But is stem cell, am I a candidate for stem cell? Is there an age barrier and is there a perfect age that this is ideal for?
Believe it or not, stem cell therapy or regenerative medicine is great for everybody. Now, when you're younger and you go through trauma or an injury, you kind of lose that signal because it gets quickly depleted fast because you're trying to
Mm,
regenerate, right? You're trying to do something. So you need
right.
to introduce stronger signals just to continue that rebuilding process. As we age, of course, our signal goes down and then we need that. So is there an age limit? No. Now, when you look at your knee, there's only so much you can do to your knee. Decrease the inflammation, do a cortisone shot. You can kind of mask the pain and make, hide it, but you still got that problem. You have to
Mhm.
regenerate that cartilage. There's only one thing that does that, and that's that ability to signal that cartilage to grow that
Ah,
tissue. So it doesn't really matter the age. It's everybody. Anybody that has chronic injury, arthritis, or just repetitive stuff, yeah, that's the best candidates.
okay. Well, let's say I cycled. I used to cycle at least 50 miles a day on my road bike. My neck is, but I also know that I'm predisposed to arthritis. I know I have it. It's in my baby fingers. But I also know when they did my knee that I had arthritis, and then they cleaned all of that up. That being said, I don't have any pain in my knees. I just walked the Camino. I mean, I just walked over, I don't know, 190 miles. No pain. No
Wow.
inflammation, no swelling. But what I do have is when I sit here for 10 hours a day, when I get up, throbbing. So I put a weighted heat and vibrating on my knees before I go out and start walking. Tell me about that. What's going on there?
Okay, so think about like what athletes do before an event. They do what they call a dynamic stretch. You want to increase circulation, get that like
Mm,
static fluid out of there. Because fluid, it kind of needs to be moving in and out. You want that flow, that flow of going in and out. So when you start moving your leg in some type of vibration or what they call like dynamic movement, you want to mimic that movement. So that's an oncotic pressure of negative and positive gradient. Push that fluid out with pressure and then create a vacuum, suck it back in. It needs that fluidity back in there. Once you start getting that motion, now
mm,
you do your actual event, like your walk, or like baseball pitchers, they do a lot of warm up. They start without no ball, they just do slow motion and they start speeding it up until they get that velocity.
mm,
Then they put the weight on there. So that's what dynamic is. Now afterwards, after you go through your event, they call it
right.
static stretching. You just, you hold a stretch, hold a movement, all that stuff that you want to combine from the before, then, of course, during the activity and after. So it's a whole cascade of just properly taking care of your body so you can do those activities. So when you're doing that prolonged sitting, you're keeping your joint in one position. It doesn't like that.
No.
If you sat there and just kind of knee extension just forward backwards, you can warm your knee up right away too. Just get that movement going.
Oh, I love that you gave me that tip. I did buy the under my desk cycling thing. That didn't work. It was clunky. I almost broke my toe on it. But I love that I can just do that. I never considered that. Isn't it crazy how we don't consider? I always say keep it simple, make it easy. And you just gave me something very easy that I can do that probably will be enormously beneficial
Yeah,
to me.
I think that's the biggest thing is the simple. As simple is the easy. I always talk to my patients as if I'm talking to, because it gets complicated when you talk about anatomy, physiology, or the pathology. So if you can
Right.
bring it down to a level where it's so easy to understand, now it's almost easy to work with them because they understand their condition and then the process of what we're trying to do to help them along.
Well, in looking at stem cells and the difference of live stem cells and what's going on, once again, we're back into that language that not a lot of people understand. What do they need to know about what's available to them and all the confusion around it?
Okay, so again, you hear those clinics that say, I've got live cells, 10,000,
Yes.
10 million, I got those cells,
Yeah.
right?
I'm so confused when they say that. I'm like, let me Google that. Let me chat GPT that. Yeah.
Yeah, I think they think that because of live cells, it's going to do what they're. So let me take a couple steps backwards here. So research shows that these stem cells, mesenchymal stem cells, have what they call the ability to do
Mhm.
like pluripotent. They kind of differentiate into target tissues of like tendons, ligament, muscle, and all that stuff, right? So then, and then they stop. They don't explain the mechanism. They say it just differentiates and it understands and it goes into that tissue and it,
Mm,
it turns into it. Then you start thinking, well, I mean, it sounds neat and it's a good selling point. It's going to turn into it,
right.
but the science doesn't back it up. It doesn't make sense. So then, of course, we talk about the signals and the messages, and that's what's really important. Cell-free, meaning there's no nucleus. It's just a capsulated type of like a cell with no nucleus, but just the information, the signals, and then it goes to a target area that has that same receptor that can just connect in there, and then it tells that target tissue to regenerate, to do your job.
Mhm.
So when you see these clinics that have like 10 million, 20 million live cells, I mean, it's a good little, I guess a marketing campaign. But here's the thing. If you look at the dynamics of what really goes on with the regenerative medicine industry, there's a lab. There's a lab that gets this tissue from a C-section delivery baby, and the tissue they obtain is the umbilical
Mm,
cord. It's called a Wharton's jelly. So when this lab gets this gelatinous material, they'll go ahead and take the mesenchymal stem cells and then they cryopreserve it and they put it into like a nitrogen filled tank that's less than, I mean, it's negative like 166 degrees or something like that. So they kind of store it. So then when the clinic says, okay, I want my supplies of these mesenchymal stem cells, they'll cryo ship it from the lab to the clinic. Could be like hundreds, could be 1,000 miles, but they'll get it. So when
mhm.
the clinic gets this type of like stem cells, mesenchymal stem cell in a cryo package, this is where things happen weird. So
Mm,
apparently when the cell is cryoed
yeah.
at the very initial, they're live cells. When they
Mhm.
get it to the clinic, the problem is that taking it from a cryo or solid state into a liquid or gelatinous state. A lot of people, what they do is they defrost it within their hand. You'll see a clinic that say, oh, I'm going to go ahead and take this cryo preserve and then I'll go ahead and defrost it in my hand into, that temperature that your body has. That's too fast. It's called shock thaw. When you thaw something too fast, it dies. The process from taking something in the cryo to a room temperature or your body temperature, it's a multiple step. It takes probably maybe 45 to an hour to get that process back to its liquid state to keep
Mm,
the cells alive. But here's the funny thing. So now you have the shock thaw, you have this supposedly live cells. It's not live anymore. What it is it's basically just you just shock thawed it. You kind of killed it, right? But here's the
right.
thing, it still works. So now it's not so much about the live cells, it's the next step, which is the signals. They secrete, these live cells secrete this kind of message. It's always getting out information. That's
Right.
what you want to get. That's what's important. So now these people that get these injections, they feel good. It's not the
Right.
live cells because you basically from the shock doll you kill them. It's really the messages that they call the EVs, the extracellular vesicles. Now, once I understood that whole process, forget the live cells. I want the cell-free, which is a smaller molecule. When you have a smaller molecule, now you have something that's easily transmitted through the skin, the transdermal
Mhm.
component. And the best thing about it,
Mm,
a live cell has its kind of dangers. You don't know what it's going to do in your body. Your body's going to look at that like, is that an antigen? Is that a virus? Let's attack it. It's going to
right.
start, a lot of people talk about, I feel sick after these injections because
Right.
they're
I've heard
doing
that.
something. So that's the thing is your body think it's like something that it's not supposed to be there. So it
A
builds
foreign
that kind of like,
object. Yeah.
yeah. So it starts fighting it. Now, if you have what they call a cell-free, well, the body doesn't look at it like an antigen, like a virus. So that's the neat thing about this whole world that's moving towards a cell-free. It's non-invasive in the sense of, it's transdermal, and there's no possible tumor formation. That's what you got to be careful because when you have a DNA that's going in your body, you don't know what that DNA is going to turn into. You say I want to heal my
Mm.
tendon. Well, what if that DNA is coded to be a follicle hair or something else? You don't know what it's meant to do. So that's why the
Ah.
danger's there.
Wow, that was really, really informative. So tell me, what is the process between the two, alive and how is the other one extracted or is it grown? Is it organic? Tell me more about that. I don't know.
Okay, so during the process of getting a donor, these labs or these sort of like these umbilical cord banking, right? You know how
Right.
people want to bank their cords. Well, during C-section delivery, they'll opt into that world of banking. But during that process, they'll ask the mother, say, would you like to donate some of your tissue in exchange? There's a monetary or a discount for your banking.
Mm.
So then that's how that tissue gets obtained. Once that tissue gets obtained, or before they get obtained, you have to do the vetting process. We're going to do the history of course, the family history, do some blood work, make sure they don't have no, like any type of pathology or any STD. Make sure
Right.
the tissue is clean, and
May I
then you
ask, I
go
just
ahead.
interrupt with that. I hate to interrupt, but you've intrigued me. Is it just C-sections or is it natural birth? Is it just C-sections? Because I see C-sections on the rise, and we just discussed my daughter just had a natural birth baby 2 weeks ago, but they were leaning towards C-section in Florida at a beautiful, I call it a spa hospital. But
Yeah,
so is there any connection there to
I
the
think
uprise in C-sections?
Yeah, I think well, I don't know the reason why for the shift going to C-section. I think it's less trauma for the mother in the sense that you don't have to go through that pain and labor. I'm just thinking the easiest reason, but I'm not a woman, so I don't know how to identify that in
Well,
my
I did it
question.
3 times. I'm going to guarantee you there is pain, serious pain.
I have 3 kids, and the funniest story so this is I'm divorced now, but during that time, my first daughter was being born. So the labor is long, and you know how they give that monitor around your belly, and you can see the contractions coming. So I would sit there and I was so shocked. I was, oh my gosh, I can see the contraction. And I would tell my ex-wife, I say, here it comes. And after like an hour,
You're going to be electrocuted any second now. Brace yourself.
and
Breathe,
she
breathe.
was so pissed off. And she goes, "Stop, tell me." I said, and one time I told her, "Oh, this one's a big one." And she got so mad at me. She goes, "Get away from me." I was so intrigued by all this kind of technology and seeing this kind of
Yeah,
like, basically
yeah.
C-section
So
delivery.
it is just C-sections that they can extract that DNA. It can't be from. Interesting.
Yeah,
Really interesting.
because it's less trauma. When you go with a vaginal birth, it traumatized the tissue, which is the afterbirth, placenta and the umbilical
Yes.
cord.
Yeah,
But
I
when
was
you have a
in there for it
C-section,
all, and it was fascinating. I mean, I've delivered 3 natural birth, but that was quite something being there present for all of that and watching that. I was fascinated with the energy of all of that, of what was
it,
available.
it's the most amazing thing to see just something that was an idea and now it's growing and then now it's out and it's like I can't believe that that's mine. That's something that
Yeah.
I made. I know it's
Yeah.
difficult on a father's side to say that, but
Oh no, I'm right there with you. I just said there's 8 billion people in the world, but I show people anytime well, let's just take the moment and there's baby Luca, and
yeah.
that's him just 2 days old, but it's such a miracle. And now it's a double miracle that they can take that, all that nutrient, all of that, and they can extract something that can rebuild cells.
Yeah. Yeah. The signaling. Yeah, absolutely.
Yeah.
So the neat thing about this whole thing is that it's all once you understand where the trend's going, you're starting to hear these words like exosomes, peptides. Now you're looking at
Yes.
signaling. You're not looking at these cells anymore as far as
Mm.
the live cells. You're looking for the cell-free molecules. Then you start understanding it's the information, it's the signals. Now you're thinking, all right, this approach is a little expensive because donor side, human tissue, the
Yeah.
lab, and all this kind of like
Yeah.
this
Stem cell
processing.
people most say, I'd love it, but I can't afford it. Is it
Yeah.
getting more affordable?
that it's going to, it's still expensive because the process is very difficult.
Right.
Now, the worst thing about this, it's not really regulated by the FDA once you go past the lab. Once you're at
Going
the
to ask you
clinical,
that next because I thought the regulation there really
no.
kind of I mean, like, I'm out. It's
Yeah,
not regulated.
it's the wild, wild west. There's no in the
Mm.
pharmaceutical world, there's a lot of processing just to get a drug on the market. You've got to go through a lot of things. This process, it's just here we go. Let's go ahead into it. So the checks and balances at the clinic side is not really as extensive like anything else out there. Even OTC, over the counter, like drugs or something like that, they've got more regulation than this
Right.
whole process. So that's why this world is kind of unique. So the
Right.
efficacy right now is being tested. The FDA controls the lab that actually does that processing. So a lot of labs are being shut down. They're being shut down because
Ah.
because they can't pay it, they can't pass the actual the testing, or they get caught. And then when they get caught by not using human tissue or the wrong tissue. There's labs out there that use
Ooh.
animal tissue. There's some that use not.
Ooh.
Oh, it's awful. So the thing is that when you're at the clinic side, there's no checks and balances. You're not going there analyzing. You're just trusting the lab that goes, okay, I got a cryo piece here. Let me go ahead and defrost it with a shock thaw, and let's
Mhm.
go ahead and go into it. I'm gonna trust everybody beyond that.
So you're going to pay all this money and you don't have any gauge on the efficacy of of how this is going to work for you. You just
Yeah.
like, I'm going to just trust the process that some people rave about it. And so we're going on faith of what's going. What made you write the book, The Future of Regenerative Medicine? What lit you up? I mean, you're a chiropractor by trade. You've worked with a lot of sports. You're day to day in practice. What what lit your fire about stem cell? Because man, your fire's lit. You are a plethora of and a deep dive on stem cell.
I think it started when I started this world of a sports world, sports chiropractic, right?
Mhm.
So because I started at UCLA, they're the top of the collegiate athletes, right? And then they
Yeah.
go from, college to the pro world, and you start seeing how they take care of themselves. Because when they go to a professional level, they've
Hmm.
got a team, not only a team of physicians, but off team, they have their own private stuff, and that included me. So during that process, you see how they quickly recover. When you play a season, you're kind of beating your body
Mm.
up. You have to learn how to recover, and then you learn
Right.
about their recovery process and you hear about this stuff and you study about it because you want to be well versed as much as these other physicians.
So you saw success. You said, "Hey, their recovery time is twice as fast, and they're back out there because and due to stem cell."
Yeah. So once I understood that, I offered that, and I also said to myself, there's got to be a better way because during the process of season, they don't really do regenerative medicine because when you look at the injection, the needle, it's invasive. You have to go into the target area and then you make a secondary injury site. Now they're hurt again because, oh, I'm hurt from my original, and now I'm hurt from the needle penetrating through that tissue. So that's why they don't do it during the season. So what they usually do is the
Mm.
masking. They like to do like a pain med. They hide the pain, and then they'll say, "I'll deal with it after the season." So
Right.
once I understood that the world that
Mm.
needs to be in the regenerative medicine should be in season, off season, it's just a delivery. How do I deliver these signals into your tissue? And that's where transdermal applications started evolving. So I started understanding, all right, we just got to get this information, this signal down there. And the reason why I wrote the book is that number one, this conversation. I would have this conversation with you, with this person, and it's pretty much the same Q&As. So I said, let me write this book. The book will explain most of these
Mm.
things. So then I can just say, hey, I'll refer them, hey, take a look at this book. It'll explain easier
Mm.
because in the book it talks about stem cells, the history, the different kind of stem cells, and then
Mm.
how it does, how the procedure goes in the present time,
Mm.
and then where the future is at. So there's a science side of it, and also there's a layman's version because there's a guy named Jeff in there, and Jeff's journey is the discovery of stem
Mm.
cells and the discovery of what's going on and in the future and why he wants to go into the topical and not the injectable. So that book is
Wow.
kind of a fun game for me to help me like kind of save my breath. Say, hey, go get my book. It'll
Right.
explain a lot.
Right. So the invasive process of injectable and transdermal is that patches? Is that cream? What?
It's just a cream. It's just a nice
So it's a
simple cream.
cream.
Yeah, it's real
Rub some
simple.
cream on, just get your what is that? So after they do that, What is the result time from application to regenerative? I'm starting to get results.
Okay, so with injection, it's just one injection and you wait and then, you start seeing some progress as far as regenerative in about 30, 40 days. But the
Hmm.
first time you start getting the injection, you'll start having relief like 1 week because it's an anti-inflammatory.
Mm,
There's a signal there that says, all right, shut down the inflammation. So that's why you get the pain
mm,
relief. But a topical, it's not 1 day, it's 30 days because it takes time to saturate the tissue to get to that depth.
right.
So every day for 30 days, and its equivalent is the injections. That's how much information you get. But the neat
Mm,
thing about the topical is that you don't stop play.
mm,
You can continue on.
mm,
Now with that, there's no like aggressive type of like recovery. Like I got to stop moving because I just put a needle in my body. I can You can continually play. You can continually do things. So that's why it's perfect for weekend warriors, everyday person, and get
mm,
that regenerative type of signal to your body.
mm. I'm looking at all my questions here, and I mean, I have so many. You said you wrote the book because you were getting the same questions over and over again. I'm going to flip this. Instead of asking my questions, I'm going to ask you, what do people need to know about this? Who is the ideal candidate? What is the process? Where can they go to find the research? And what's available to them right now?
Okay, so I'm gonna go backwards because that's like 9 questions in there. So
I
I'm gonna
know,
do,
I
I'm,
know.
I'm,
It was. I won't even remember, but it just kind of unfolded. Who
yeah.
is it for? How long, and because there's so much research out there. People get overloaded. And we talked earlier about the AI chat GPT and they get all the information and they're like, "Oh, that's so overwhelming." What's the
Uh-huh.
I want to know the easy way to do this.
Well, I think the easiest way, of course, there's the book, but if you go on my website, which is regen.com, RheeGen.com, you
Mhm.
can learn about this topical world of regenerative medicine and the EVs, the signals, the cell-free molecules, and understand the concept. And then in there's a bunch of research and white paper
Mm,
and all kinds of neat things that scientists like to see. But for laymen,
right,
you can just like listen to the show, understand what we're trying to talk. But if you have any
right.
additional questions, there's an email, I'm sorry, there's a info button in there or email. You can email me, ask me a question. I can help you along with that.
Oh, I love that.
But
Who's
but
this not for,
okay,
Dr.
this
Rhee?
is
Who's it not for?
it's interesting. I think it's for everybody. I guess the biggest thing, just like anything else, you don't want to treat a person that's pregnant. You don't want to
Mhm.
have like that, you've had possible cancer in your body. You want to make sure you don't have that, and just the classic stuff that you think that's common sense speaking. You don't want to
Right.
regenerate. If you have a tumor or cancer, you don't want to
Want to
regenerate that
regenerate
faster.
cells.
Yeah.
Okay. Makes
So,
sense.
so the neat thing about like topical, it does localize, information to that damaged tissue. But part of it
Mhm.
also goes systemically. It gets absorbed into your bloodstream. So it does go through your body. So our body has the ability to regenerate all the time. It's a signal. So sometimes when you start having that signs of being like tired or like the aging,
Mhm.
it's because we don't have that signal. Well, this has a signal. And what I was going to tell you is that remember we are talking about the pricing and how it's just,
Mhm.
the injection is expensive. Even the topical, the version from the human tissue is expensive. Retail's about $1,000. But right now, if you understand about the signaling,
Mhm.
I've now taken that information and I paired it and I found plant-based signals that's similar to the ones that we're
Ooh.
looking at. So now I'm switching over regen from the human site to the plant site, more so because of the price point. It's gonna be a lot cheaper and it's gonna be over the counter. It doesn't have to have a doctor's script or anything. This one goes strictly to the consumer. So the neat thing about that is that same potency for regeneration, same signaling, but it's a lot
Mhm.
cheaper and it's plant-based. So there's no
So people don't need
formation.
to come to Tampa to have an appointment with you and get this. Can they go on your website and purchase that?
Uh,
Or where do they find it?
yeah, so right now online you can get that, and then with the basic information, and then your provider, you just tell your provider, your doctor, say, hey, I want Regen, and they contact me, and I would give it to them, and they dispense it to the patient. But the new
Uh-huh.
version, it goes strictly right to the consumer. So that's coming out here in about 4 months. We're doing the testing. We passed a lot of great tests. I've got some IPs for patents and stuff. You know how you got to do all that, like
Oh
that
yeah.
formulation. So
Yeah.
we're crossing some barriers. We're doing great things. And then the exciting thing is that now, We're looking at that price point of $1,000. Now it's coming down to $100. Same potency, but now it's more inexpensive.
So we're looking at July of 2026 because we're in March of 2026. For the people that are listening to this and listen and re-listen to this next year, it is probably July, June, July that this will be available of 2026. How excited are you about this?
You know, it's like probably like pregnancy. You know, the first month, first trimester, it's like I'm at the delivery. I'm at the third trimester. I'm get, you know, I'm acting like I'm
Yeah.
the mother, gaining the weight, water weight. I've got that edema.
Well,
I'm there.
you know what? This is your baby. This is your, your the patent, all the process, just like all of the time and the trimesters of pregnancy. It's crazy we use this analogy, but it's true. I've just gone through this with my daughter, so I'm like, I'm so here for it. I love that analogy because it
Yeah,
really is your baby that you're birthing into the world.
I'm
I
excited.
think.
You know, I think the great thing that I'm really excited about is that, I know what it does. I
Hmm.
just want everybody to have the ability to get involved with this thing because everybody has
Mm.
pain, everybody has an issue, and nobody has the luxury of having that money to pay for that injection would cost five to $15,000. Regen, $1,000. And it just gives the everybody person the ability to have this world now. And that's what I'm excited about,
Mm.
is that now I'm reaching out to a larger audience that here it is right here. Take advantage of this thing. There's gonna be so much science behind this. I've got some great research behind it,
Mm.
great like support. I've got a great team, and we're moving forward. So yeah, I'm very excited, and it's interesting because I see something from a vision from years ago, from something
Mm.
that people used to do in the different kind of therapy world, and I said there's got to be simpler, simpler, and I think because of
I
that thing
love
that we
simple.
have.
You're speaking my language.
That's what it's all about. I mean, if you complicate things, you knock out maybe 90% of people. So I like to bring it so simple that anybody can do it. It's like, oh, I get it. It's real simple. I
And
guess
so many
that's
people don't like needles too, and the cost. So you're really maximizing on the natural healing process. You're elevating our system of the natural healing process. You're really, I look at the energy stacking of that versus the invasive injection that we're like, we don't know the DNA we're injecting. We don't know, but we're hoping for a good result. You've taken it, and I love the plan. I love, this is why you're here. I loved this. It's the future of medicine, and I think do you think do you consider yourself a pioneer,
I
a
think.
leader
Okay, no,
in
I'm gonna tell you what I think. I think
the truth
no,
here?
the truth. I always think differently. I'm always that person. Like, why is everybody going to the right?
Mm.
I'm the going to the left. What is? I don't understand it. How come they don't see what I see?
I tracked a lot of that.
You know what I mean? It's like you don't see what I see, so that's why I try to stay to myself because if I try to explain to someone, it's hard for me to like give them what I've been through and how I think, and then I apply it and I said, think like me. It's not gonna happen. So that's why if you ask me, am I a pioneer? I think I'm just different, and that difference is that leadership that people want to follow. Maybe that's how I look at it. I just know that what I feel in my heart and what I was like something destined to do, it's fun. It's like easy go. Just roll with it.
Well, we know there's obstacles out there on the FDA, all of the things, but how willing are people to embrace this? Are you finding that other practitioners and athletes and in layman's terms, how are people receiving this?
That's a tough thing. That's why I do these shows. I write articles. I wrote the book. You have to explain. They don't see the science. They see a generic, like, okay, I see this cell. It's going to turn into this cell. It doesn't do that. It does other things,
Mm.
and that's why it's a process. You know,
Mm.
the great thing about this is that when I'm first on the market, I have no competitors. But the problem is that I have to educate a lot. And it's education, it's just explaining. So there are athletes that are willing to understand and open their mind. And some are like, no, I want to go with the old stuff. And don't worry about it. I know where I'm at. I know where the future's
Hey,
at. I'm
quick
just a little
fixes
ahead of
are quick fixes. You know we live in a world. Look at Ozempic, look at all of it. Instead of health, I mean, people love the instant quick. I mean, we live in America. I mean, I don't know about the other, but we really do love that. But I think the pendulum is swinging to the longevity and systematically almost of something that is easier and less invasive and statistically, Are what where are the statistics lying right now on the efficacy of this? We talked about it earlier, but I don't think I got a number on the efficacy on the topical.
Yeah, well, topical, the efficacy is fantastic. You're not going to have any type of deterrent as far as like the safety mechanism. But
Mm-hmm.
the injection, people don't know. It's like I don't want to
Yeah.
know. I just want to, I think it works because this
Mm.
person, I've got this influencer that does it. He says it works. Let's follow that person.
Mm.
Now, does that person know? Here's a funny thing. When you look at doctors that in this clinic world,
Mm-hmm.
they don't know. They just know it works. It makes money for
Mm.
them. Let's do it. So that's why the mechanism is very important to explain to people in not only
Mm.
physicians, but to patients, people, everybody. So then they understand, I want signals. I want the right information. I want to activate my biological, information to turn on because these signals are coming into my body.
Wow. If we look at medicine even 100 years ago, the evolution of
Oh
knowing the
yeah.
body and the signals, and I mean, I'm just fascinated with where we're going with this. But what is the people in this wrap up? What do you want people to know today?
I think the biggest thing is that you have to really tune into your body, number one, and understand don't push yourself. Don't push yourself when you work out because you don't want to
Mhm.
overtrain yourself. Now, if you find out that you're overtraining because you don't give yourself recovery time, you've got to either stop working out or speed up the recovery. Recovery meaning that go into regenerative medicine. You need this thing. So it's either you continue your workouts, but find a secret to help you recover or slow your workouts down. So recovery is important. So when
Mm.
you understand that concept, find a product like RheeGen. Do that, and then you continue on your workouts. So I think that's the
Mm.
biggest thing is that don't change your lifestyle because of an injury. Find a way to prevent it or getting destroyed by that process.
So, I'm going to circle back to a question I asked before. People that say, I'm bone on bone. I hear this a lot. I'm bone on bone. If they're bone on bone and they don't have any tendons in there to build, or is that even true? I was told by another doctor that's not even true. No one's bone on bone. But can they build muscle? Can people build muscle if they don't have that cartilage that between that in order to
Well,
build the muscle?
Well, here's the thing. So when you look at the bone on bone, there's a space in there, a cushion called a cartilage. The cartilage is like the
Yeah.
cushion, right? So that
Hmm.
gets kind of destroyed. You can have some signs of that little tissue, the cartilage in there, and still be just okay, but you'll have a little irritation. Once you get a bone on bone, now you're changing the cortex of the bone. You're going to change the dynamics. It's not going to be a smooth ball in a socket. It's
Hmm.
going to look rough. It's going to feel like you're clunking, like basically like an old tired out machine that has no oil. It's
Hmm.
going to clunk clunk clunk. Well, that's bone on bone. If you're not having those symptoms or signs or sounds, then you're okay. You still have a little tissue. You're still available into that world of regenerative. But when you look at an
Hmm.
X-ray and it doesn't look like a normal ball and socket, it looks like a bunch of cloud and messy and junk. Well,
Hmm.
no, you destroyed that joint, and you're definitely going to have to be in that world of like, hip replacement, knee replacement. So if you know where you're
Is
at,
the topical good after that? If people that are listening have had a hip replacement or knee replacement or shoulder surgery, a shoulder what a rotator cuff surgery because they've torn everything and there's nothing left and then the arthritis is cleaned up. Is this gonna if they do start topical, is it gonna regenerate so they can build more muscle? Am I even connecting the dots here? Connect those
you know,
dots for me.
no, you're absolutely right because think about it. Anything that let's think about surgery. Surgery is trauma. No matter how you want
Hmm.
to define it, it's trauma. It's either trauma by you voluntarily going to
Yeah,
surgery or trauma by you falling down and tearing that muscle. It's still the same
yeah,
thing. So your
yeah.
body needs to recover. The minute you go through like that injury state, it's acute, you waste a lot of signal because the signals are going out, say, all right, we need to rebuild, we need to, we got to inflame first, then we got to slow the inflammation down, and then, but we have to send the signals to regenerate. Well, because of our limited amount of signals, we deplete. Well, you need to get that. So if you're post-op surgery, regenerative medicine is fantastic because it gives you the ability to have those signals say,
Mm.
continue, keep going, keep working, because you deplete it. So after surgery, hip replacement, knee, rotator cuff surgery, anything that you have to recover, fantastic. Because that's how it is. You don't know what if it's, voluntarily surgery trauma
Right.
or you fall down. Both are the same type of answer. Use regenerative medicine, use regen.
So, what do you see the biggest mistake that people do, and how can they rectify that? What do you witness the most?
Overtraining. It's overtraining and not listening to
Mm.
their body. Because when you start working out and you start pushing yourself, remember the old saying, no pain,
CrossFit.
no gain.
Oh yeah,
Yeah.
and the CrossFit days where we all ripped, tore my knee, tore my shoulder. Oh yeah, I remember. Yeah.
Yeah.
More
So
is better. Pain is
so
gain. Yeah.
if you can balance that point of like I'm gonna push myself and then get the other side, which is the recovery, and get it back to 100% and then push again, because you're typically working out is all about breaking down muscle fibers and getting it back to where it grows bigger, better, stronger, and then breaking it down again. So you're constantly growing and growing. But when you're breaking
Mhm.
it down and not giving the ability to recover from resting and letting it heal,
Right.
well, now you're not at 100%, you're 80%, and you're going to break it down another 20%. So by the time that
Mhm.
you're really getting bad, you might be only 20% of your maximum output, and then mentally you start saying, "Why am I not performing like I used to?" Then you start blaming like your kids, your dog. It's really you. It's you in your recovery.
I love that. I love that. Boy, Dr. Tommy Rhee in the house today, regenerative medicine. Where can people find you? What are, spill all the things. Are you out there speaking? Are you at events? Can they just find you in Tampa seeing patients all day? They can go to your website. Give me all that information, and I will follow up with all of his deets, and we'll probably have him back. We just talked about it live in San Francisco. We're going to do another deep dive on this. We're just scratching the surface to give the layman some information here, which I am fascinated, by the way.
Yeah, yeah.
Fascinated.
I'm in Tampa, Florida, so my practice is called physical chiropractic. You can Google that. And then, of course, you can go to my website for the RheeGen, RheeGen.com, and you can learn about the product. The book, of course, at Amazon, The Future of Regenerative Medicine. And if you just Google me, you can see everything that pops up, the
Yeah.
good, the bad, the ugly. You can see, no, not that
Yeah,
bad. It's
there's a
just,
lot there. Yeah, there's a lot there. And I think working with athletes, your pendulum is swung where and like you said, it's for everybody. Yeah, I mean, if you've got a cell in your body, which we all do, and we're looking at signals and peptide. I know there's a deeper dive here, but I think this is a great opening conversation to let people just on their radar know there's other options and opportunities, and we don't have to just tolerate.
yeah.
I think joint pain.
Yeah. Hey, Dean, I totally forgot. I've got a TEDx talk coming at the end of the month, so I'll shoot that information out if you can just
Oh,
pass it out to
absolutely.
your.
Oh, yeah. Oh, that's fabulous. Oh, I can't wait to hear that. And what is it on?
It's called Transformation, but TED Talk or TEDx's are like you can't really talk about products, but you can just talk
Yeah.
about like the
Or
idea and the
results.
concept,
Yeah.
the results, yeah, all that
Yeah.
stuff. So it's a great conversation to have.
Yeah. Well, you know what? I've loved this conversation. Again, Dr. Tommy Rhee in the house. Wow. Wow. This is just the beginning. This is just the beginning. It's kind of like, remember when AI was like, and we're like, whoa, can't go there. And now everyone's chat GPT, even messages. Let me take the message of how are you? Let me put that over there. It's crazy. And I'm like, and Journey always comes, I'm like, oh, you just chat GPT'd me a response to how are you today? I'm gonna start saying, hey, on a scale of 1 to 10, where do I find you today? Yeah,
Oh,
thank you for your time. I love your energy. You are, I consider you a frontier on, thinking outside the box, which is, I think, genius. Anyone thinking outside the box is genius. Because I think cell-free regenerative medicine, I think is the future.
Dana, I'm telling you, you're awesome, man. Thank you very much for those compliments and those kind words. Man, you're awesome. I
It's
love
the
talking to
truth.
you.
Oh, wow. I mean, I would not have said it if I didn't mean it. People are going to be like, she meant that because yeah. Well, I know I've kept you from your patients. Thank you for your time. You're awesome too. I'll see you in San Francisco. So everyone, hey, thank you for tuning in today to the Dana Grant Show. To learn more, I'm going to have all the links and connections and how you can find Dr. Tommy Rhee. I love that name, Tommy. And yeah, you're going to adore him. And he said, hey, reach out on an email. He'll answer your questions if we haven't covered it here, and get ready for a deep dive in the next few months. And we're going to go even deeper. All right, everyone, take care. And thanks for joining us today.